Equine Herpesvirus Type 1, or EHV-1, is one of the most significant infectious diseases affecting horses globally. It is not only highly contagious, but also biologically complex, capable of causing multiple forms of disease, ranging from mild respiratory illness to severe neurological dysfunction and reproductive loss. What makes EHV-1 particularly dangerous is not just its ability to spread rapidly, but its ability to persist within the host for life, reemerge under stress, and infect multiple organ systems through a single infection pathway. To fully understand the risk this virus poses, it is necessary to examine its biology, its mechanism of transmission, and its impact on both individual horses and entire populations. So what is EHV-1? EHV-1 is a double-stranded DNA virus belonging to the alpha herpes virinae subfamily. Like all herpes viruses, it has the defining characteristic of establishing lifelong latency after the initial infection. Following exposure, the virus does not leave the body. Instead, it enters a dormant state within specific tissues, particularly the trigeminal glandula and lymphoid tissues. In this latent state, the virus is not actively replicating and cannot be detected through routine diagnostic testing. However, latency does not mean inactivity. Under physiological stress, such as transportation, competition, illness, or environmental change, the virus can reactivate. Once reactivated, it resumes replication and can be shed into the environment, often without obvious clinical signs. The capacity for silent reactivation is one of the primary reasons EHV-1 remains endemic in the horse population. EHV-1 infection follows a multi-stage process that allows it to move from a localized respiratory infection to a systemic disease affecting multiple organs. Initially, the virus enters through the upper respiratory tract and infects epithelial cells lining the nasal passages. It replicates locally, leading to viral shedding in nasal secretions. From there, the virus invades nearby lymphoid tissues and infects circulating leukocytes. This leads to viremia, a critical stage during which infected white blood cells transport the virus throughout the body. During viremia, EHV-1 targets endothelial cells, which line the interior of blood vessels. Infection of these cells results in inflammation, vascular damage, and in some cases, thrombosis. The consequences of this vascular damage depends on the tissues affected. In the central nervous system, it leads to ischemia and neurological dysfunction. In the uterus of pregnant mares, it disrupts blood flow to the placenta, leading to fetal death. EHV-1 is transmitted through both direct and indirect pathways. The primary route of transmission is through inhalation of respiratory droplets. Infected horses shed the virus through nasal secretions, particularly during the early stages of infection. However, indirect transmission plays a significant role in outbreaks. The virus can survive for a limited time on surfaces such as water buckets, feed tubs, tack, grooming tools, clothing, and human hands. These objects, known as fomites, can transfer infectious particles between horses. Critically, horses may shed the virus before clinical signs are apparent, and some may shed virus during reactivation without appearing ill. This makes early detection and strict biosecurity essential. EHV-1 infection can manifest in three primary forms: respiratory, neurological, and reproductive. The respiratory form is the most common and the least severe. It is characterized by fever, nasal discharge, lethargy, and decreased appetite. Despite its mild appearance, this stage is highly significant because it is when viral shedding is most active, facilitating rapid transmission within a population. The neurological form of equine herpes myeloencephalopathy is the most serious manifestation. It results from the vascular damage within the spinal cord and brain, leading to impaired blood flow and tissue injury. Clinical signs include ataxia, hind limb weakness, abnormal stance, toe dragging, reduced tail tone, and difficulty urinating. In severe cases, horses may become recumbent and unable to rise. The progression can be rapid, and outcomes are variable, ranging from full recovery to permanent deficits or death. One of the most economically and emotionally devastating consequences of EHV-1 infection is abortion in pregnant mares. EHV-1 induced abortion typically occurs in the later stages of gestation, often between the 7th and 11th month. In many cases, the mare shows minimal or no clinical signs prior to the abortion. The underlying mechanism is vascular damage within the uterus. During viremia, the virus infects the endothelial cells of blood vessels supplying the placenta. This leads to inflammation, reduced blood flow, and ultimately placental insufficiency. As a result, the fetus experiences hypoxia and dies. The fetus is often expelled suddenly and in many cases appears relatively well developed and fresh. This can be misleading as the mare may have appeared clinically normal just prior to the event. In some cases, infected foals are born alive but are weak, infected, and typically do not survive. Abortions caused by EHV-1 are highly contagious events. The placenta, fetal fluids, and tissue contain large amounts of virus, which can contaminate the environment and infect other horses. This is why immediate isolation and proper disposal procedures are critical in breeding operations. After the initial infection resolves, EHV-1 enters a latent state within the host. Latent virus persists primarily in neural and lymphoid tissues. During this phase, the horse does not exhibit clinical signs and is not actively shedding the virus. However, reactivation can occur at any time, particularly during periods of stress. Reactivation leads to renewed viral replication and shedding, allowing the virus to spread to other horses. This cycle of latency and reactivation ensures that EHV-1 remains present within the equine population indefinitely. Effective control of EHV-1 relies on rigorous and consistent biosecurity practices. Routine temperature monitoring is one of the most important tools for early detection. Fever often precedes other clinical signs and may be the only early indicator of infection. Isolation protocols must be strictly enforced. Horses showing signs of illness as well as new arrivals should be separated from the general population. Movement control is essential during outbreaks. Restricting the movement of horses and minimizing contact between groups reduces the risk of transmission. Hygiene practices must be maintained at all times. This includes hand washing, use of gloves, and disinfection of equipment and services. Effective disinfectants included bleach solutions, accelerated hydrogen peroxide, and other agents capable of inactivating enveloped viruses. Finally, reducing stress in horses can help minimize the risk of viral reactivation. Proper management, nutrition, and scheduling play a critical role in maintaining immune health. EHV-1 is not a simple respiratory virus. It is a complex, systemic pathogen capable of causing severe neurological disease and significant reproductive loss. Its ability to spread silently, persist within the host, and reemerge under stress make it a constant threat within the equine industry. However, through scientific understanding, early detection, and strict adherence to biosecurity protocols, its impact can be significantly reduced. Ultimately, prevention depends not only on knowledge, but on consistent, disciplined action.